Coverage of the 26th annual meeting of the ASMBS is sponsored by Allergan, makers of the lap band AP system.
Hi, this is Leslie Thompson with the Weight Loss Surgery Channel, reporting from the 2009 annual meeting of the American Society for Metabolic and Bariatric Surgery. And I am joined by Dr. Reyes, who has a bariatric practice in McAllen, Texas. Dr. Reyes, thanks very much for being with us.
Thank you for having me.
Now, the reason I wanted to talk with you is because you are doing single incision laparoscopic surgery for bariatrics, which is very innovative and a hot topic here at the conference. Describe how the single incision laparoscopic surgery process works and really why it's beneficial to the patient.
Well, it's beneficial to the patient right now because it gives them a better cosmetic result. Now, we have tried to see if it improves their length of stay at the hospital or it decreases the pain. It has not been successful on those arenas, but at least the cosmetic result, yes, has been successful.
And so, as the doctor's going in through one port, they still need multiple instruments. How does that work? How can they get all of the surgical instruments in through the one incision?
Yeah, we have learned that as the instruments get smaller and smaller, we can work in smaller spaces also by mobilizing the tissues, visualizing the fascia, which is where we have to pierce to go into the intra-abdominal cavity, by multiple small incisions or by a larger incision with a industry port. After that, it's just a matter to, in one single line, be able to see the anatomy to perform the surgery. Now, it is a surgery is not for everybody because it depends on what procedure we're trying to accomplish, where we can do the incision, and the incision may be larger or not as cosmetically accepted as with the other small incisions that we have conventionally done.
And obviously this has applications far beyond bariatric surgery. For general surgery procedures, it may be more appropriate even to use the single incision for the cosmetic purpose.
That's correct. We started with the laparoscopic cholecystectomies, which has been very successful because most of them are through the umbilicus. That's why some people even call it the scarless incision, because we can hide the scar from that procedure. Now, where we're talking about more complex cases, that's colon resections or weight loss surgery, then we have to really pick up the right patient to give them the full benefit of what we call right now single incision.
Mm-hmm. Now, I know the sort of new trend and things that are currently in trials are is the endoscopic approach. Would that be a viable approach theoretically for doing these same types of procedures, or can you not access the you can't access the other organs going in through the mouth the way you can laparoscopically going in through the outside of the abdomen?
But right now we cannot do it. But it seems to be that the industry is giving a lot of attention to that, and I'm sure that eventually it will happen. Right now, seals is the new step forward. It is not just like something that we know it's going to probably stay, but it's just a step towards a better procedure, so later we can probably really perform the scarless surgery.
Now, you've been doing this for about a year in your practice with the single incision surgery. It's still very new and very revolutionary. Have you heard any feedback from other doctors, either pro or con?
The consensus is divided. It's definitely a more challenging procedure, and I think it's not for every single patient. It is not for every single doctor to be performing these more advanced laparoscopic procedures. But it is an instrument that we have now. We learned that we have the banding, the sleeve gastrectomy, the gastric bypass, because not one single surgery is appropriate for all the patients. So now the seals procedure will be beneficial for some patients that may benefit from a better cosmetic result.
Excellent. Well, Dr. Reyes, thank you very much for your time today. Appreciate having you. And thank you for joining us. I'm Leslie Thompson for the Weight Loss Surgery Channel.